Scrubs. This week on Gross Anatomy, we dissect the TV show Scrubs, the OG, and the new reboot. Check it out. Are we live?
We are live with Gross Anatomy Podcast,
where we explore the sights, smells, and sounds of medicine, how it relates to movies, TV, books, podcasts, and the world around us. And once again, I am Dr. Jason Cohen, and
I am Lauren Taylor, and we have a medical show review for you.
Today's our scrub day. I'm in Scrubs. Actually, that's normally, if you notice, on podcast days, I'm in regular clothes because it's my office day, and I dress up one day a week. But today, I actually had to do a surgery this morning, so I'm in Scrubs. So in honor of Scrubs, I'm scrubbed.
Oh, I thought maybe you did do that just for this episode.
No, but it's very appropriate. It's very appropriate.
It is appropriate. So did you still have to teach the interns today or the medical students? They're not interns.
Well, today was our graduation day for our pre-med students. So we finished our spring session and we just had graduation, and every student wants a picture with me, and it's really cute. It's really sweet. They all want, like, as if I'm someone or something. They all want to take pictures with me, which is really adorable. And I got some nice presents from some of them. One of them knows me well and dropped off diet vitamin drinks, mineral water. So, and I like this flavor. This flavor is the pineapple passion fruit flavor, so 0 calories. So
I've never tried that. That sounds good.
Yeah, it's a yummy one. I love passion fruit. So that's Naraya. Thank you, Naraya, for bringing me yummy drinks.
That's very nice. Real go-getter.
Go-getter, exactly. She's trying to get a good grade, but I don't do grades, and this thing isn't about grades. So
it's not about grades, but it is about teaching, which is what Scrubs, I think, really is. It's about mentors, right?
Yes.
Don't you think Scrubs is a show about mentorship more than any other?
That's a very good point. It actually is about mentorship more than most medical shows. I like that.
Yeah, I do too. And I looked up Bill Lawrence, the creator, who's created pretty much half the shows on Apple. Bad Monkey, Shrinking, Ted Lasso. And now he's done this new show for HBO called Rooster with Steve Carell. He did Spin City back in the day with Michael J. Fox.
Wow.
Cougar Town. He did so much.
Wow.
But I was originally looking up because I was like, maybe he was a doctor, because we've talked about that before, writers that were doctors or not practicing doctors. But I didn't know why he wanted to create a medical show, but it said that he just had a desire to portray the reality of young doctors rather than high stakes melodrama seen in other shows. So, I guess he just wanted to do the start of a doctor's career. I guess that interested him, but he was in no way in the medical field.
Interesting. Yeah, I would have thought he would have had some kind of medical background, but that's amazing. We all talk about, you and I talk about, you're a writer, I'm a wannabe writer, but I don't think I could write what I don't know.
Yeah, you have to do a lot of research, which I'm sure he did. I couldn't find a connection. Maybe he's talked about it. There has to be one where he knows a doctor. I didn't see anything where his dad was a doctor, but I feel like there's got to be some kind of personal connection, don't you think?
There's got to be either that, or he's just really a good writer, baloney-er.
Yeah. And then I started thinking about all the shows he's done. Maybe he's just a great writer. It's not like he's a real soccer coach, or it's not like he's in a couple things.
He might just be good at knowing how to do that thing. So certain people are just good at that. I'm envious. Ron Bass is good at that. The guy who wrote Rain Man too. He was pretty amazing at that.
Yeah, some people are just really gifted. He sounds like he's one of those people. So I watched. We told each other that we were going to watch Scrubs season 1, episode 1, so the pilot, and then watch the revival, which I think they're just calling season 10.
Oh.
I'm pretty sure it's just called Scrubs, season 10.
Yeah, I think it's just called Scrubs, right?
Yeah.
Scrubs, A New Hope.
But I did it reverse. I watched Scrubs season 10, episode 1, and then I watched the very first pilot.
Oh, interesting. Let me ask, Scrubs is one of those medical shows I never really watched. I'd seen clips over the years, but it was one of those shows I never watched. What about you?
Yeah, so I had only seen like little clips. Like I feel like it would just be on, like if you go places or something would be on somewhere, and I'd be like, oh, that's funny. Oh, that's humorous. Um, and then during the pandemic, when there was like, I was struggling to find things to watch, I started watching Scrubs and I enjoyed it, but then I got kind of, bored with it. And I looked it up today. I was like, I wonder like how many episodes there were. In the first season, there were 24 episodes. And I think that's
Mm,
why 'cause we're not used to that kind of television.
right.
So Scrubs started in 2001 when there had to be like 24 episodes. So of course, my brain was like, this is too much. But back in the day, that's what it was.
That was normal. And it just came out once a week, and that was how people watched it.
Yeah, and you didn't binge it. So I don't think it's meant to be binged,
No,
or it wasn't.
no. So that's interesting that you started with the new season.
Hmm.
Let's just say you had started with the new season of Scrubs. Do you think you would have gone back to watch season one?
No, but I'm glad I did watch it that way because I was like, oh, they're kind of identical in a way.
Yeah, a little
Like they
bit.
have a lot of similarities.
It's really interesting that they pretty much brought back every character. That was impressive.
Yeah. Yeah, I did look up. There's the medical chief in season one, episode one, Dr. Kelso. I guess he's not coming back this season, but he's like 85 years old, so maybe he'll come back if they have
That's what
another
I was
season.
wondering. Is he even still alive? But I guess he is.
Yeah, I looked that up too. So yeah, it was. I didn't really remember the pilot episode, but I thought they were both well done. I mean, they both were about like young doctors, coming into the field for the first time, not being able to do an IV or being scared. So I
Yeah.
was wondering if you related to that in any way, because we'll just start with the pilot episode of Scrubs. It's basically like JD and Turk, who are best friends, and they're going in this hospital together, but one's a surgical intern and one's a medical intern. And always, I feel like in every medical show, so there must be some kind of truth to it, surgical interns are the cooler, more athletic ones. And it even says this, and the medical interns are like the chess nerds or something. That's even what JD said.
There, in terms of stereotypes, there's some truth to that, but there's, um, the maybe surgeons, there's a little bit of a fraternity sorority mentality, maybe, but then within it, you definitely have your exceptions, and super cool medical docs and super nerdy surgeons, but yeah, there definitely is some, there are a lot of jokes around the different specialties of the personality types, and there is some truth to all of that. So I still remember as a medical student, um, on my medical rotation at Kings County Hospital, which was and back in Brooklyn, New York, and back in the day, we as students had a lot of autonomy, and the residents really had a lot of autonomy. And I remember at one point we called the surgery consult or something like that. And oops. We called the surgery consult, and hang on. And sorry.
You're fine.
And and this woman like just strutted. I still remember. I all I remember is like seeing her in her like scrubs, and she had this strut, and she was the resident, and she was probably like a third year consult resident, and I had no idea who she was, but she had this swagger, and I still remember her like coming in, telling us off basically, like, and then I remember watching her swagger away, and I don't know what her I don't to this day I don't really know what her face looked like. I just remember her long hair and her swagger. She had this, and it was such a like, that is a surgeon, and
See? And the TV shows get it from somewhere. I'm like, someone saw that. Maybe they became a consultant or a writer. But
totally.
that the pit has that too, where like the surgeon, like I feel like she comes in with like a swagger and an attitude. So it's
Yeah.
still going. That
Yeah,
character, like,
and there's definitely something to that, and it's great to see women with that swagger.
yeah.
It's so cool, you know?
Yeah.
Mhm.
Yeah, I agree. Well, Turk is the surgeon in this, the guy, but I thought, well, in the pilot they did their orientation, and I didn't know if you think this was funny, but their orientation was basically a lawyer saying, "Don't get sued." It
Yeah,
was
that was
like,
cute. Yeah, we definitely didn't have anything like that, but that was an interesting take on things and cute. I had a question. The very beginning of Scrubs, they show an X-ray
hmm
right in the thing,
yeah,
and the X-ray is backwards.
it
And
is. I thought.
and is that deliberate? Do you think that's deliberate? Because
Maybe,
I
oh,
noticed
because
in
they're
the new
in,
season,
yeah.
the X-ray is the right in season 10, the X-ray is the right way. So I'm wondering, is it deliberate, or did finally someone say, "Hey, listen, your X-ray's been backwards all along"? What do you think?
Well, I'm gonna look into that, and I'll have a definitive answer for you next time. But I think because the interns are now JD and Turk are now the chiefs. One's the chief of surgery, one's the chief of medicine in the new season 10. That maybe that is intentional, right? So they're interns getting things wrong, and now they're like top of their game. I don't
Yeah,
know.
I guess so. Or I wonder, was it not deliberate then, but now they're like, oh yeah, who knows? Who knows?
Yeah, I mean, I could see the intro guy just not knowing, just creating something like it has nothing to do with anything. He just didn't
Right.
know.
Yeah. So I wonder who else, notices that. Does everybody notice it? Obviously, everybody doesn't, but
I thought that, but yes, so
yeah.
I got it right.
Cool. Good job, Lauren. And did you notice in the new one the X-ray is the other way, or you didn't notice on that?
No, I just noticed in the pilot. I was like, hmm.
Yeah. Yeah. Oh,
Okay. Well,
cool.
so do you remember your first orientation at all?
I think I remember vaguely medical school orientation where we sat in this big conference room, lecture hall, and someone said to us, back in the olden days, they were starting to try to be kinder and gentler, but they weren't really when I was a medical student. But one of the things they said is when the older person presenting to us said, when I went to medical school, one of the things they said to us is, look to the left of you, look to the right of you. You're going to be the only one here. Everyone on either side of you won't be here with you. They're not going to make it. So I do remember when I was a medical student, that person said, oh, when I was in medical school, they told me, look to the left, look to the right, no one's going to be here. These days, we got your back. We're here for you. We're taking care of you. So look to the left of you, look to the right of you. You're all hopefully going to be there when you finish. That's the only thing I remember from medical school. But that was 1995. That was a long time ago.
Yeah. Well, so the show starts in 2001, so kind of it's like similar trajectory. And I thought because they handed a beeper in episode 1, I was like, oh, Dr. Cohen had a beeper. Do you remember your beeper number? Is it possible?
No, I don't remember that beeper. I remember my beeper that I had as a fellow because I kept it for many years. But I don't remember my beeper, but I do remember getting my beeper the very first time as an intern and thinking, wow, I am cool. And I remember the very first page I got, I was all excited and I answered the call and they're like, is this Dr. Diamond? Or I think that was the name. And I'm like, no, it's Jason Cohen. They're like, where's Dr. Diamond? This is his beeper. I think he was the chief resident who graduated, and I got his beeper because he was the graduating chief resident. I was now the intern.
Dr. Diamond. That's a really cool name.
Yeah, yeah. I may have made up Dr. Diamond. I'm not
That
sure,
is,
but it's
I hope not.
possible.
Yeah. Well, so I feel like did you form any kind of cliques with any surgeons? You didn't find that at all? Like there wasn't
In
like when you started orientation, were there like groups that form right away, like friendships, or you're all like kind of out for yourself? Like, because that's what the first episode explores.
yeah,
Like it plays off the theme song, I can't do this all on my own. I'm no Superman. So like, it shows that they need each other. They need their friendships. And I didn't know if you felt the same way or there was like bonds that formed or it's kind of all made up, but.
yeah. Again, I don't really remember an orientation, but I remember, there were a group of 9, I think, residents a year. So there were 9 interns, I think, on surgery, just on surgery. So we had nothing to do with the medical people, but there were 9
Right.
surgery. Actually, there were more than 9. There were probably 15 or 20 of us. Only 9 of us went on. So yeah, we definitely bonded with some of the interns. Partly because I knew some of them as I went to residency and medical school at the same place. So the interesting thing with me was in residency programs these days, there's something called a categorical residency where you're given your spot and you're guaranteed, if you make it to, if you're a first year resident, you're guaranteed to graduate these days. It's categorical, and it's a 5-year surgery, is a 5 to 7 year residency. If you make it as a categorical resident, you're theoretically, unless you majorly screw up, you're guaranteed to graduate. But in the olden days, a lot of residency programs didn't have that automatic categorical finish. They had something called a pyramid or a pyramidal system. So, and with that, they hired a ton of first year residents, and not all of and a lot of those wouldn't make it, or would go on to do certain things, or just wouldn't, and only a smaller number would make it to second year, and a smaller number would make it to third year, and a smaller number. And in the olden days, that's how it was. It was very cutthroat and very competitive to try to make it in a residency. And when I was starting out, the pyramid system had already been gotten rid of in name, but where I was, it was still kind of a pyramid where they would offer certain residents a chance who didn't get a spot, but they'd say, you know what, residents go in the lab and we got to fill spots and yada yada. So I was kind of in one of the last pyramid programs. I was guaranteed a spot, but interestingly, 2 guys that I was with, the crazy thing is I was a 4th year medical student at the same place, and I was doing a rotation in the surgical intensive care unit at Kings County, which was a tough place. It was a crazy tough place to learn to do stuff. And the residents I was a medical student, I was a 4th year, the residents that staffed that intensive care unit, the ones who were in charge of that intensive care unit, were 2nd year surgery residents. And we had 3 2nd year surgery residents, and they were in charge. There was a 4th year or a senior resident over them, but the 2nd years were the ones day to day running that intensive care unit. And 2 of the guys were these really good guys, Frank Tarantini and Pete Patetsios. I'm giving you guys a shout out. They're really good guys, really fun guys. And they kicked the crap out of me, scudded me out, maybe do a lot of the work. But they were good guys, and we really got along and really liked each other. And they were great. And the interesting thing is those 2 2nd year surgery residents were still in the pyramid system. They weren't told, hey, you could stay, you have a spot. So at the end of that year, I wound up finding out that I'm going to be an intern, a surgery intern at that same hospital. And the chief of surgery at the same program said to those 2 guys, you know what? We'll keep you. We'll make you categorical residents. We'll make you set in the system, but you got to start all over again as first year residents. So the crazy thing is I started out as an intern after being a 4th year medical student, getting the crap kicked out of me. And those 2 guys who had kicked became my classmates. And they wound up becoming, good friends of mine. I've since lost touch with one of them. One of them actually
do it 2 more years. That's not fair. Wow.
Yeah, it's great. But they at least got to finish and went on. I'm sure they were great guys and great surgeons, and they went on to be really good docs. What I liked was I love that you mentioned it's about mentorship. I love the fact that the older attending, who the guys thought was going to be this nice guy.
Mm-hmm.
The other, what's the name of the guy who's the mentor, the actual mentor?
Dr. Cox, Perry Cox, I think.
Yeah. And what's his name in real life? I like that actor.
Yeah, no, he is good. He's I wrote it down because I thought so too. John Christopher McGinley.
Right, John McGinley, exactly. I wasn't he in like Platoon or something? Wasn't
He
he?
was in Platoon. That's crazy because I looked him up today and I didn't remember that, but you did.
Yeah,
Nice.
yeah. And he played like a crazy guy, or he goes crazy in it a little bit in Platoon. But
Yeah.
but I like the fact that you think like he's going to be the evil guy, and the
Mhm.
other guy, the older guy, is going to be the nice guy. And I love how that flipped a little bit, and he went on to be the mentor.
Yeah, no, I love that too. I mean, their relationship is great. I mean, all the cast has great chemistry, so I think that's what kept that show on for 9 seasons, and obviously got a 10th season 15 years later. I mean, it was, yeah. So it's crazy that the first episode came on 25 years ago. That's why I was like, it's got an interesting trajectory to like you in your surgical career now, kind of. And
Yeah,
I don't know. You started your own practice, but
yeah. No, it was interesting, and what's also interesting, it was the pilot's 21 minutes, I think. Right? Did you notice that?
yes, I wrote that down too. I was like 22-minute episodes, which I guess because they were doing 24 episodes a year. I mean, that makes more sense. But
And commercials, and there were commercials.
yeah, I didn't look at the new season, like how long that one was. It might have
I
been
didn't
short
look
too.
either. But that's why actually we watched 2 episodes of the of the first season. We're like, it was only 21 minutes. Let's watch another episode.
Hmm. Yeah, it was cute seeing him young and then seeing him now. And
Seeing them old.
you know, Dr. Cox calls JD newbie, and the new one he just calls him oldie. It's just pretty easy nicknames.
Yeah.
But I did want to ask you. So the new one is like obviously Turk and JD are now the chiefs in their field. Um, I don't really know what Elliot, the girl, does. I didn't really understand her job position. Did you? She's played by Sarah.
uh, I think just another internal medicine doctor who's like in charge of the students, maybe.
Yeah, I didn't really understand her position or her role in the hospital, but maybe that becomes more clear. But we watched the first 2 episodes, and I did think, yeah, I mean, it's basically just them now being the mentors, right? Like,
Yeah, I did
and
like, how what's the guys, the chief of medicine who then passes the torch on. What's his name?
Dr. Cox.
Dr. Cox.
And
I do
yeah,
like the way he did that, the way he passed the torch on and all
yeah,
that.
and that was very sweet. I like that too.
But that was maybe the only part of it I really liked.
Okay, so I wanted to know too, like in the first episode, obviously the X-ray is wrong in the intro, but like, did you have any other problems with like the medical aspects of any of the episodes that you saw?
No, I mean, it was funny. It was cute how in the beginning he would have all the nurses do his procedures. That was interesting. And for sure, at least where I trained, that would never have happened. But today, the interesting thing is the nurses do a lot of procedures. The nurses are trained now to do procedures. And like, so, if they have that specialty, the nurses can do procedures. And what's interesting is, as an intern, at least at like fancy hospitals, you get a lot less experience of putting in IVs and doing all that stuff these days, which is kind of interesting.
Oh, yeah, that is so. Yeah, nurses can do more. Okay, yeah, because the new season just had interns not being able to do like, yeah, the the IVs or whatever they needed to do too, or being scared.
Yeah, yeah. Um,
But the new season had like an HR person played by she's an SNL alum, Vanessa Bayer. But like, have you seen any of that? Like, are there just like more HR people telling doctors what to say, not to say? Is that like a real
there's a
surgeon?
lot of there's a lot of emails,
Mhm.
and a lot of courses that we have to do, which are torture and ridiculous and baloney. But
And
um,
costing the hospital a lot of money. Somebody's making a fortune on stupid e-courses. Jesus.
someone's making a lot of money on that. But we reap what we sow. I think we created that environment for ourselves. But and I think actually that it the new Scrubs does a good job of kind of making fun of
Hmm.
how worried we are about being
Well,
politically correct, and
mhm.
and so I kind of liked it. I think they kind of just took it a little. It was too much a little bit, but I think
Yeah.
it's true. I mean, that's really to some degree how it is,
I was wondering about that because Dr. Cox tells JD they're like all the interns are now little fragile Christmas ornaments, and he just can't seem to get through to them the way he needs to, and
Yeah,
he
there's a lot
realizes
of truth to that.
his time.
Yeah, and especially in medicine, especially in surgery, surgery used to be hard, and hardcore, and I mean, before my time, it was kind of a malignant, pathway up to some degree. You would get hazed. Uh, that a lot of that stopped, when I was going through, but you'd still see it a little bit. But now, no, now there's something called pimping, on rounds, and you see it in all the TV shows. They ask the doctors, they start at the junior. Tell me, Doctor So and So, what's the differential of da da da? And then they go up the hierarchy. And these days, you actually have to be careful how you ask your questions like that, so that you don't come across as aggressive, and you don't want to insult them, and you don't want to hurt their feelings. And there's a lot of stuff you have to be careful about.
I mean, of course they did get that from somewhere, but I'm just so surprised that's really seems to be true.
Yeah, it's really true. It's really true.
Like, obviously the emails or like the email police, they made just a real person in scrubs. They even he calls her the friendship police or something
Yeah,
like that.
we don't have people like that, but there is HR. There's at big hospitals. There's so many people looking at what we're doing and what you're doing, and you could get in trouble for something that normally is nothing, but you just said it the wrong way or the wrong time or and it could blow
Oh
up.
my gosh, and doctors have enough to worry about. That's too much. No wonder you guys are experiencing burnout. Oh, the feelings police. That's what he calls her, the feelings
Right.
police.
Exactly.
Uh, so, well, that is in the new season. Turk is experiencing burnout, which, I mean, obviously all of the HR stuff can, I'm sure, just add to it. But his main complaint, at least in the show, was like he was performing surgery on a guy who never listened to him. Like he's basically removing body parts, he said, from a guy that, wouldn't eat right, was drinking, like wouldn't follow any of his advice. Um, and his family's just going to complain when he dies. He knows that, you could have, why couldn't you do more?
Right.
And I was like, I actually know someone like that has had so many surgeries. And I'm surprised they even perform anymore on him because he smokes. He does all the things that they tell him, you can absolutely not do this after surgery. And then they'll perform another surgery on him.
Yeah. I get that's got to be hard. That's got to be hard. That's got to be tough. I don't know if I hear people burnt out about that. I hear them frustrated about it, and maybe bitter and joke, but I haven't heard anyone burnt out over that. But that's definitely could be a reason to be burnt out.
Right. I mean, that's just like, I guess the example it gives on the show. I'm sure there's more to it than that.
Yeah.
That'll probably come up in a later episode. But burnout is just so, that word is exhausting now. It's just been said so many times. But have you noticed like surgeons quitting because of burnout or anything like that more recently?
One thing I noticed was, and this was a while ago already, the major rise of the electronic medical record. What was really interesting was that docs who were a little older, who were like maybe 5 or 10 years away from retiring, because they didn't want to have to deal with and learn the electronic medical record. I remember at that point in time, there were a decent amount of guys who kind of said, I'm out. I'm done. I don't want to learn this. The electronic medical record's been around now for 20, 25 years, maybe even closer to 30, between 20 and 30 years. So I remember 20 years ago, when it came on the hospital, maybe even 24, 25 years ago, there were guys, I'm out. I was going to practice for 3 or 4 more years, but I'm done.
I did look up because Kelso in the show, like he seems older. I was like, how is there an age limit to be a chief medical? And there isn't.
No.
Actually, it's against your like union rules. Like you can't have age discrimination.
No, not at all.
You've never seen that be a problem where doctors, like if they were in their 80s still performing surgery? Like,
I have a little bit. Not that often, but I have a little bit. I do remember what was crazy was in my residency, there was this surgeon who seemed really old at the time because he was white and haired and everything. And he was a very good surgeon, but he was a crotchety guy, and not that pleasant a guy, but a very good surgeon, I think. And he had a stroke, and half of his and he lost he developed weakness in half of his body, and then he went back to operate. And it was amazing to watch this guy, still pretty darn good, with one hand not working as well, and still doing surgery. And I was thinking, and anytime I assisted him, I'm like thinking to myself, I can't believe they're letting this guy operate. But he was still kind of decent. But I don't think that would have. I think today, if that happened, they probably wouldn't let him.
Right. Okay. There needs to be definitely some limits. I mean, I guess I get it, but I kind of get age limits too in a way, because I was watching this show. Have you ever watched the show Paradise? It's on Hulu.
What show?
It's called Paradise.
No.
It's on Hulu. So they had season 1 last year, and I didn't watch it, and season 2 just came out. So Travis wants me to get caught up on it. So I'm watching it, but I get pulled out of it because there's a pilot that's 80 years old, and I know you can't be older than 65 years old and be a pilot. It's not legal. So it was like totally pulled me out. But that's what made me think of, like, is there an age limit for a chief? So that's interesting. You can't be a pilot over 65, but you can do surgeries.
Chiefs probably doesn't, but surgery, operating maybe, and you don't have to be. You could be a chief and not necessarily be in the operating room. You could be a really good administrator and teacher and things like that. But it's not uncommon to have, docs working well into their 70s, even 80s.
Okay.
Yeah.
I mean, I guess
I don't want to be, but it's not uncommon.
Okay. Well, that was one of my questions, so you answered that. Also, there in the new season, Dr. Cox says it used to be see one, do one, teach one. Now it's not the same rule. Was it that when you were?
Yeah, and we still talk about that. I mean, it wasn't totally that, but that was kind of how we were brought up and what we said. It was your first surgery, you're assisting there, you're watching it. Next one, you're doing it. As long as you're paying attention and reading and learning, and then the next one, it really is that way with procedures a little bit and things like that. Depending on the difficulty of the procedure and things like that, it can be, and even to this day, it can be a little bit. There's still an element of see one, do one, teach one.
Okay, but then you said you only liked basically Dr. Cox's part in the revival. You didn't like a lot of the show.
I didn't love it. It's not something I definitely wouldn't watch it. Yeah, it kind of it was a little too like hammy, actory, and I could tell they were having fun and so happy to be there and everything, but it just seemed a little too gratuitous, and just right. What do you think?
Well, yeah, and so I feel like I can't be offending Bill Lawrence because he's like one of the most successful TV writers ever, and I'm one of the few people that didn't like Ted Lasso, but I do find that there's always I like how his shows are light, but I find like there is a cheesiness to it sometimes that is hard for me to enjoy.
Yeah, with their handshake thing, it was just a little too cheesy. The first season, I thought was the right amount of cheese, but this was just a little bit way too much cheese, right?
Yeah, and I guess the actors Zach Braff and Donald Faison, who played JD and Turk, are really best friends in real life. So I do feel like that comes across, and it's fun. But
yeah, their camaraderie is fun. But just like the back carrying him on his back and the handshake stuff. I mean,
yeah, and I think that's my problem with Shrinking too. Is like it's just a little too much.
Is it?
Like, yeah. a little too much cheese where I wish it'd just be a little bit more serious. Even though it's funny because I'm always looking for like light shows, but for whatever reason, this one
Yeah.
doesn't.
Well, let me
Yeah,
ask you a question. I know it's not. Did you watch The Studio at all? I'm curious.
I did. It wasn't my favorite show
It
either.
also was too it
Yes.
had that same level of just cheese, right?
I don't understand, to be honest, how it's winning every award. Like, congratulations to them, but I just didn't, I don't get it.
Yeah, same. I watched a little of it and I was like, I'm done. I can't. I wanted to like it. I wanted to love
Yeah.
it, but it
I
was
mean, I
just
don't want everything to be completely dark, but I just, yeah, there needs to be like a little bit serious. I don't know.
yeah, or just not serious, just less cheese.
Less cheese. There you go.
Less cheese. Goofy is fun, but just or if it's a slapstick thing and you're going for that, that's a different story. But
I think
it's
that's what
trying to
Scrubs,
be realish comedic, and it's just cheese.
yeah, I think Scrubs does go for the slapstick. I'm not sure, but
But the first season, I thought did it
mhm.
did it okay. I thought the funny was funny, and I thought it did it okay. Who's your favorite character in Scrubs?
I was going to ask you the same thing.
I beat you to it.
I mean, I guess I like JD. I used to like Zach Braff back in the day. I mean,
Yeah,
I haven't
I
really
like
seen.
Cox. I think he's great.
He is pretty great.
I
That's a
like
good
that. I like that kind of scary mentor thing. Who at the
one.
end of the day is a good guy. I love when a bad guy is really a good guy. That's something I really enjoy in movies and TV and film and
Yeah,
theater.
I guess that's what made the pilot enjoyable. That little twist. I agree. So maybe the season 10 just needed like a little something extra to
Mhm.
keep you interested.
Yeah. Doesn't he say, there's always a villain and always a hero? Who's the villain? Is that a
Yeah,
line
that's what
he?
we say in the first episode. Yeah.
Yeah. Who's the villain? Who's the hero? Oh, it's an
Mhm.
interesting twist on things. Yeah. What
All
else,
right,
Lauren Taylor?
that's it. So I'd say I'm going to keep watching Scrubs. You're not going to.
No.
It's okay.
Yeah. I would watch some more of the OG, but definitely not
Mhm.
interested in the new. Definitely
You
definitely
don't
over
like
the
the
new.
oldies.
Huh?
You don't like them because they're oldies now.
No, I just
I know. I'm
too
just
too
kidding.
cheesy. Too cheesy. Yeah.
All right.
All right. Thanks for joining us, everybody. Thanks for joining us on Gross Anatomy. We love your feedback. We love hearing from you. Reach out to us on our Instagram at Gross Anatomy, TikTok, and we love hearing from you. We really do. Thank you.
That's it for this week. Thanks for listening to Gross Anatomy, and be sure to subscribe to our podcast so you can check out more episodes on the evolving sights, smells, and sounds of medicine. Gross Anatomy is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.